Hello friends, when we are dispensing an eye ointment, always patients are confused about the usage of eye ointment. Most of the time patients are asked the question like how to apply the ointment, or how to apply inside the eye or outside the eye, or apply using the finger, like that lot of question will arise from customer. It is a responsibility of a pharmacist to explain clearly about the usage of an eye ointment. Today we are going to discussing about this topic. Welcome to another chapter of 1 Degree Change, a continuous learning program for the pharmacist. Before going to the usage of eye ointment, some other important points always you have to inform the customer. First one is, if the prescription containing more than one eye ointment, or along with the eye ointment any other eye drop is there, means patient have to use the drops first and eye ointment have to use at last, and there must be a minimum gap of 10 to 15 minutes between the eye drop and eye ointment. If the prescription containing more than one eye ointment, there also patient have to apply one ointment first, and after 10 to 15 or half an hour patient can use the next ointment. Minimum there will be 10 to 15 minutes gap. Don't share one eye ointment with any other people or any other family member, even they have the same type of infection. Also, once the course is finished, discard the tube and don't use this particular used tube again, because all the eye ointment is coming with a preservative, and this preservative can protect the eye ointment maximum for 1 month once it is opened. Once open the eye ointment, the expiry date of the ointment is 1 month from the date of opening. Even the printed expiry date is long. Once it is opened, it is valid only maximum for 1 month time. So next we can see how to use an eye ointment. Lot of people think that eye ointment have to apply using the finger. It is not like that. It is not allowed to touch the tip of the tube with the finger. Ointment have to apply directly from the tube to the eyes. So for applying an eye ointment, first we have to stand or sit in front of a mirror where we can easily visible to the eyes where we are going to apply the eye ointment. Tip the head back, then gently pull the lower eyelid and look up. Then hold the tube above the eye and gently squeeze approximately 1 centimeter of the ointment from the tube along the inside of lower eyelid. While doing this, always take care, don't touch the tip of the tube to any part of the eye, and also not allowed to touch the tip of the tube with the finger. And after that, blink the eyes for 2-3 times for the uniform spreading of the ointment all over the eyeball. Initially, while applying the eye ointment, you will feel some blurred vision, and once we blink the eye 3-4 times, the vision will be clear. And if doctor prescribe more than one eye ointment, wait for 10 to 15 minutes, and after that patient can use second eye ointment. And if doctor prescribe any other eye drop along with this particular eye ointment, use the drop first and wait for 10 to 15 minutes and use the eye ointment. And if a person is have the habit to wear the contact lens, don't use the contact lens while using the eye drop unless doctor advice. And always take care about the storage of eye drops. Some drop have to keep in, some ointment have to keep in 2 to 8 degrees Celsius, and some can store in the room temperature. And read the instructions correctly and make sure that patient is following all the instructions you are giving to the patient. Thank you for watching my video, and if this information is help you to make a 1 degree change in your professional life, please share with your friends. Thank you.